Welcome to Medically Speaking, a podcast for your good health from the University of Maryland Medical Center and the University of Maryland School of Medicine in Baltimore.
Celiac disease is a genetic disorder affecting children and adults. People with celiac disease are unable to eat foods that contain gluten, which is found in wheat and other grains. For many years, researchers have been working diligently to find the cause of this disease and better treatment options for those who suffer from it. This is Becky Sorrell, and I'm here with Dr. Alessio Fasano, Professor of Pediatrics, Medicine, and Physiology at the University of Maryland School of Medicine and Director of its Center for Celiac Research. Dr. Fasano, let's start with an explanation of celiac disease. What exactly is it?
Celiac disease is a clinical condition that affects people of all ages that typically present with gastrointestinal symptoms. Until the recent past, we really believed there was a sort of food allergy, what now seems more a condition of autoimmune cause, so like having diabetes and multiple sclerosis.
How common is it? You don't hear much about celiac disease, or you haven't until the past few years.
Well, actually, the disease is extremely frequent, affecting roughly 1% of the general population. The problem is that it's been overlooked for many, many years, particularly here in the United States.
Why is that?
We have a certain mindsetting about celiac disease in the past. We believe there was a disease affecting only little kids. It was a disease that, in terms of symptoms, was characterized by the chronic diarrhea, weight loss. Over the years, we learned that it's much more than that. And looking just at kids with this kind of symptoms was like looking at the tip of an iceberg. In the past few years, we realized that the disease is much more complex in terms of the way it presents itself and the ages that are affected. And now we have the appreciation that it's much more frequent than previously described.
What are its symptoms?
Well, I mentioned already one, that is the classical way that the disease presents itself, with chronic diarrhea, weight loss, and other symptoms that can affect the gastrointestinal tract are abdominal pain, big belly, so there is a distension of the abdomen, gas, and vomiting, and sometimes rather than have diarrhea, you can have constipation. However, there are symptoms that are way beyond the gastrointestinal tract that can be the only way the disease presents itself. Nowadays, the most frequent symptom is anemia of unexplained reasons. And with that, typically you have associated chronic fatigue.
How specifically is it diagnosed? Is there a test for celiac disease?
Well, once you make the clinical suspicion of a situation of celiac disease, yes, there is a very, very good tool that is a specific blood test that, if well interpreted, is extremely specific and sensitive. In other words, really can pick it up the vast majority of people with celiac disease, ruling out other conditions. This test has a great level of confidence but does not have 100% certainty. And because this is a condition that will imply a change in lifestyle, i.e. a gluten-free diet for the rest of your life, in order to really reach that level of 100% certainty, the next step, if you test positive by the blood test, is to perform an endoscopy with a biopsy that shows the actual damage of the intestines that are typical of celiac disease.
Is there a specific population or group of people that celiac disease is more common in, children, or can you develop it in your adult years?
In the past, we had that kind of misconception that celiac disease was indeed confined to the pediatric population, particularly Caucasian population from European origin. With increased awareness and increased scientific interest, we start to look at the more broad spectrum of celiac disease, and we realize not only that it's not confined to the pediatric population, even if the disease typically, in terms of the machinery that brings to the damage, starts when you're a child. The disease can present itself after many, many, many years of silent damage of the intestine. And there are a wide variety of ages at which the disease can present itself. It can be, kids a few months old and like a few weeks after they're introduced to gluten in their diet, to people in the 90s and everything in between. Also in terms of races, we were, wrongly under the impression that it was just a premises of the Caucasian population from Europe, and now we know that that's not the case.
Let's talk about treatment. What can you do for people who have celiac disease?
Well, the treatment it's based on a better understanding what this disease is all about. As I was mentioned before, being an autoimmune disease, the idea is this is a recipe that has two ingredients: genetics that you're born with, many genes that needs to come together to make you genetically susceptible to celiac disease, and the environment. Now, the peculiarity of celiac disease is the only autoimmune disease for which we know for sure what is the environmental trigger. There happens to be this strange protein, it's called gluten, that is present in several grains, particularly wheat, rye, and barley. That is the offending, environmental trigger for these people. And therefore, it's when the genes that you're born with and the grains containing gluten that they interact that you develop this autoimmune process typical of celiac disease. So the concept is pretty straightforward. If we eliminate one of the two ingredients, we don't have the recipe anymore. We can't eliminate the gene score yet. So we eliminate the grains that contain gluten 100% and forever. That is, on a pure theoretical basis, a straightforward approach, but in practical terms is extremely complicated because of the wide variety of foodstuff containing gluten and because 99% gluten-free would not be enough.
Do you hear from patients that once they start a gluten-free diet that they do in fact feel better?
They absolutely have a 360 degrees turnaround. It's one of the most rewarding diseases to deal with in terms of being a physician because, you make miracles for these people because really there is a tremendous change in what has been many, many years of symptoms that these people have been experiencing.
What research has been conducted at your center that shows promise for better diagnosis and better treatment?
We develop a specific test, what is called an ELISA test. That's the one that's currently commercially available that we all use for the screening test for celiac disease. So I believe that, that was a major accomplishment here.
Dr. Fasano, talk a little bit about how hard it is for people to adhere to a gluten-free diet and to shop for appropriate foods.
Nowadays it's extremely complicated. The reason why is because, first of all, gluten is abundantly present in foodstuff, not only in food that naturally contain gluten, like pasta, pizza, beer, bagels, and cookies, but also in some prepacked food that you will not even suspect that may contain gluten. Gluten is a very cheap, very efficient biological glue that keeps components together. So in candies, sometimes when two components don't stay together well, gluten can be added to keep them together. Ice cream, same story. And currently, there is no law, at least until the recent past, that will ensure that you may be able to clearly identify a product that contains gluten, because gluten can be labeled as natural flavoring or a natural product without, say, the word gluten. Now, the possibility to identify clearly food that contains gluten is a matter of not just a kind of diet that you embrace for your own pleasure, like to be vegetarian. This is a medical necessity. Embracing a gluten-free diet is like, for celiac, is like taking insulin every day for diabetics. So if you don't do that right, you expose yourself to major possible consequences.
This is Becky Sorrell, and I've been talking with Dr. Alessio Fasano, Professor of Pediatrics, Medicine, and Physiology at the University of Maryland School of Medicine and Director of its Center for Celiac Research.
You've been listening to Medically Speaking, a podcast produced for your good health from the University of Maryland Medical Center and the University of Maryland School of Medicine in Baltimore. This podcast is meant to provide general information, not to replace your consultation with a personal physician about your particular health concerns. To reach a University of Maryland physician, call 800-492-5538. That's 800-492-5538. Or visit our website at www.umm.edu. Again, that address is www.umm.edu. Thanks for listening. We hope you'll join us for other Medically Speaking podcasts.